Did you know that about 1 in every 200 pregnant women receives a diagnosis that might sound scary at first, placenta previa? But here's the good news. In 90% of cases diagnosed early in pregnancy, this condition resolves on its own. Today, we're going to break down everything about placenta previa in simple terms so you can understand what it means, what to do, and why there's often no need to panic. Let's start with the basics. Think of your uterus like a house, and the cervix, that's the opening at the bottom, is like the front door where your baby will exit during delivery. The placenta is like a special life support system that grows during pregnancy to feed your baby oxygen and nutrients through the umbilical cord. Normally, this placenta attaches to the top or sides of your uterus, well away from our front door. But in placenta previa, the placenta grows lower down and partially or completely covers this cervical opening. It's like having furniture blocking your front door. It makes it difficult for the baby to come out the normal way. Doctors classify placenta previa into 3 main types. Complete previa means the placenta completely covers the cervical opening, like a door that's completely blocked. Partial previa means the placenta covers only part of the opening, like the door is half blocked. Marginal or low-lying placenta means the placenta is very close to the opening but doesn't quite cover it, like furniture that's near the door but not blocking it. Here's what's amazing. If you re-diagnosed with low-lying placenta early in pregnancy, say at 12, 16, or 20 weeks, there's a 9% chance it will move up naturally as your uterus grows. It's like the house getting bigger and the furniture automatically moving away from the door. The main symptom that worries most women is painless, bright red bleeding, usually after 20 weeks of pregnancy. But why does this happen? Think of it this way. As your pregnancy progresses, the lower part of your uterus starts stretching and thinning to prepare for delivery. If the placenta is attached to this lower area, this stretching can separate parts of the placenta from the uterine wall, causing bleeding. It's also why doctors advise avoiding sexual intercourse if you have placenta previa, because any activity that might disturb this sensitive area can trigger bleeding. The bleeding is typically painless, which helps doctors distinguish it from other pregnancy complications. Who's more likely to develop placenta previa? Several factors increase the risk. Previous cesarean sections or uterine surgeries. The more C-sections you've had, the higher the risk. Being over 35 years old, having multiple pregnancies, like twins or triplets. Previous pregnancies, it's more common in women who've had several children. Smoking during pregnancy, previous placenta previa. The good news? Many women with these risk factors never develop placenta previa, and some women with no risk factors do. It's not something you caused or could have prevented. Placenta previa is usually discovered during routine ultrasound scans. If found at your 20-week scan, don't worry. Your doctor will schedule follow-up scans at 28 to 32 weeks and again at 36 weeks to see if the placenta has moved up. The key is regular monitoring. Your healthcare team might use both regular ultrasound and transvaginal ultrasound to get the clearest picture of your placenta's position. If you re-diagnosed with placenta previa, here are the key precautions. You may need to avoid heavy lifting, strenuous exercise, and sexual intercourse, especially if you've had bleeding. Sleep on your side, preferably the left side, with a pillow between your knees. This improves blood flow to your placenta. Avoid sleeping on your back as it can put pressure on major blood vessels. Focus on iron-rich foods like spinach, lentils, lean meats, and fortified cereals to prevent anemia, as bleeding can lower your iron levels. Contact your doctor right away if you experience any vaginal bleeding, contractions, or severe abdominal pain. Most women with placenta previa will need a cesarean delivery, typically scheduled between 36 and 38 weeks of pregnancy. This is because attempting vaginal delivery when the placenta blocks the cervix can cause dangerous bleeding for both mother and baby. The timing depends on your specific situation. If you're bleeding heavily or there are other complications, delivery might happen earlier. If everything is stable, your doctor might wait closer to 37 to 38 weeks. Remember, placenta previa is a manageable condition. With proper medical care and monitoring, the vast majority of women and babies do very well. Modern medical care has made this condition much safer to manage than in the past. The most important things to remember: attend all your appointments, follow your doctors, advice about activity restrictions, know the warning signs to watch for, and don't hesitate to call your healthcare provider if you have any concerns. Now, let's address some common questions we hear. Will my placenta definitely move up if it's low at 18 to 20 weeks? In about 90% of cases, yes. The placenta typically moves upward as the uterus grows. Your doctor will monitor this with follow-up scans. Can I have a normal delivery if my placenta moves up? If the placenta moves away from the cervix and stays there, vaginal delivery may be possible. Your doctor will assess this closer to your due date. What sleeping position is best? Sleep on your side, preferably the left side, with pillows for support. Avoid sleeping on your back. Will this happen again in future pregnancies? Having placenta previa once does increase your risk in future pregnancies, but it doesn't mean it will definitely happen again. Does placenta previa affect my baby's growth? Most babies grow normally with placenta previa. However, your doctor will monitor your baby's growth throughout pregnancy. Are there any natural ways to make the placenta move up? Unfortunately, no. There are no foods, positions, or exercises that can make the placenta move. It's a natural process that happens as the uterus grows. Placenta previa might sound frightening when you first hear about it, but remember, with proper medical care, monitoring, and following your doctor's advice, you can have a healthy pregnancy and baby. Always consult your healthcare provider for personalized advice. This video is for educational purposes only and should not replace professional medical consultation.